topic for today's discussion is about diabetes, and what in diabetes is prevention of diabetes. Nowadays there is a lot of talk about reversal of diabetes also. So what it actually means? Diabetes, everyone knows high sugars. Why it comes? It is more genetic factors and environmental factors. Environmental factors is under our control, isn't it? So we need to work on this. Both aspects of prevention and reversal of diabetes, which is coming into practice in a big way, is mainly based on changing our lifestyle. So therapeutic lifestyle changes is what we quote it as. So what exactly? It looks at your diet, exercise pattern, sleep pattern, which are very, very important, and to prevent progression of diabetes, to prevent the onset of diabetes, or if diabetes is there, to delay the complications of diabetes. So eat mindfully, work out very well. Workout means whatever you enjoy. Today we are discussing an important aspect, maybe not as usually discussed as in any other aspect of management of diabetes. It's called as clinical inertia. I don't know how many of you have heard about it, but I am sure, including me, the treating doctors, the patients will definitely are undergoing or doing or contributing towards clinical inertia. What is this clinical inertia? Inertia means there is something in us which is stopping from doing what exactly has to be done. For example, let's say I have seen a patient with diabetes, high blood sugars, and he requires, by my clinical knowledge, to be put on insulin. So maybe I think, without even consulting the patient, if I talk about insulin, he may not like it, or maybe I myself can wait for it, or I should give another chance for him to do the diet, exercise, medications properly, and later think of insulin. So that is the clinical inertia. What a doctor is having. It means it's not that I don't know what is the time to start insulin or what are the targets, but I fail to do so or implement these things even after knowing what should be done. The topic what we are planning to discuss today in a short video is about family and diabetes. I think family is the most important and integral part of anyone's life. And when we share good, bad, and even certain diseases like the genetic diseases like obesity, hypertension, diabetes, etc., it is important to involve your complete family, isn't it? Because what we do spills over to our next generation, isn't it? So for example, my dad was a diabetic, so we already had in place the diet which was very nicely and rigidly followed by my mother. So it spilled over to us to practice to cut down the carbohydrates, improve the proteins, and he used to be regular during the exercises every day, at least 5 to 6 days a week. So that spills over. It helps in two things. One is it reduces the risk factor. Already when family and diabetes means someone else is already involved or is having some other disease. So the precautionary measures what you take to control it will spill over to the next generation or even to the neighbors. The topic for today's discussion is to avoid complications of diabetes. After all, we treat any disease so that it doesn't lead us to the complications of the said disease, and it should help us prolong life. Unfortunately, when we talk about diabetes, we name any organ that can get involved with diabetes. Hence, the complications are innumerable. Just from a simple infection to reducing the lifespan. You know, diabetes can reduce the lifespan by at least 6 to 12 years based on whether you have cardiovascular complications, renal complications or not. So it's very important for us to understand first, this is a life-threatening disease. It can cripple us with many complications, even though technically we classify the complications as microvascular or macrovascular complications. In general, if we can understand that it can affect the eyes, the nerves, the heart, the kidneys, skin, to any infection anywhere in the body, it can increase the risk of some cancers, so on and so forth.